welcome back to my channel. My name is Rebecca. Remember to subscribe and like. Subscribing doesn't mean you're going to be paying, so just remember that. So today I'm going to be talking about the personal qualities that would help you adopt in the UK as a nurse. So this is for you if you're already here in the UK and you've started your overseas nurse program, or you're currently in Africa, maybe Ghana, India, Philippines, and you're planning to come and work as a nurse in the UK. This is for you. These are personal things, and this helped me when I arrived in 2003, and I think it will help you as well. So first thing on my list is ability to adapt to new ways of doing things, because as you know, you are moving, or you have moved into a new country, and each country does things somehow differently for what we mostly are used to. Another one is, yes, the UK is an English-speaking country, so you should have a good command of the English language. You should be a listener. You should be a good communicator or have a good communication skills. You should have the ability to reassure patients and their families, sometimes in very difficult situations. That is very important. You should be compassionate. You should be respectful. You should be able to provide dignity to your patients. You should also be a teacher and an advisor, I would say, because, for example, if your patient has had an operation and they're going home, you should be able to advise them as to what the post-operative care is, or things like that. You should also be committed to providing quality care to your patients. You should be confident. Sometimes too much confidence can actually be misinterpreted as being, the word is cocky, or maybe aggressive, which is not. For example, you're having a discussion with someone. Those of us from Africa, sometimes we can be a bit loud, and that is how we are, but someone could misinterpret that as you being a bit aggressive, so just be aware of that. Willingness to also learn, and sometimes being able to take criticisms. So the criticisms takes different types, or there are different types of criticisms. Some of them are very constructive, and you will learn out of that. Sometimes you find it a bit unnecessary, but just be able to take it, you're learning. And so, you know, you can challenge it, but if you're challenging some criticisms, you would be seen as being not willing to learn. So just take it from me, I'm talking from experience, and I've worked here for about 17 years. So that would help you if you listen, you take criticisms. And also, finally, what I would advise is being able not to take every single little thing to heart. If you're able to adopt that mindset, you would be fine. Because if you keep taking things so much into heart, you would not be happy. So that is very important. And finally, I've got another finally, is willingness to start all over again. Because you may already be a senior in your practice wherever you are, but when you come here, you're going to be starting as a little bit below a nurse whilst you're doing your OSCE training. And when you become a registered nurse, you would be band 5, which is the starting point. So being able to, you know, start all over again. But at the end, the sky is the limit. And if you are determined, you would make it. So look out for my next video. I'm going to be talking about the difference between nursing in the UK and Ghana, because that is where I came from. Thank you. Remember to subscribe, and I'll see you soon. Bye.